Centre. How can I help? You had this sort of tightening off the foreskin. Can you retract it back to go for a wee or anything like that?
Not at all.
See, I'd say they look like bites.
Any idea from what?
You know, where do we go as a family to try and get him the help and support he needs?
Are you normally generally fit and well?
No, I'm bulimic.
Does that hurt there?
Yes.
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing something.
I actually found her in the hallway of the house. She was still alive, but only just, and she died 3 hours later in hospital.
Good morning, Holford Health Centre. Sally speaking.
John Ferguson, please. Hello.
Hello there.
Come and have a seat.
Right, good morning to you.
Good morning.
On Saturday, I went to the loo and had to strain to produce any stools, as it were. And when I got up, I noticed there was quite a lot of blood in the bowl of the loo. But since then, my stool's been quite loose and I've been able to go to the loo normally. And there's no blood in the bowl, but when I touch it with the toilet tissue, there's still a witness of blood. My ex-wife has been a nurse for 40-odd years, so I phoned her up and she said, well, that sounds like a hemorrhoid.
Any history of any bowel problems in the family at all?
No, not at all.
Pop yourself on the bed. I'm going to feel your belly and then I'm going to feel in your bum.
Holford Health Centre. Sally speaking. Yeah, what's your date of birth, please? 14th of March, 1974. And what's your name, sir? Oh, sorry, I'm giving you 20 years there. That's not very good, is it? God, 43, that wouldn't put you out. That's not very good, is it? Exactly.
I'm Dr. Graham. I think we have met before.
Yes.
Yeah?
Got
How
the
can
same
I help?
first name. Well, in a playful way, my cat whacked my eye,
Right.
and it's been really painful.
You're a bit swollen up all over your cheek, really, aren't you?
Yeah, like here, here,
Yeah.
oh, there.
OK. Is it getting worse?
Yeah.
Yeah. OK. Do you feel...
Like,
yeah.
it's sort of puffing up into my vision, so...
Yeah. Let me just have a feel here.
Oh,
Yeah. You a bit swollen there.
yeah.
OK. All right, let's just look at the eye area. OK. Close your eye. OK.
I think what's happened is that when you were scratched, it's maybe if some bugs have got in under the skin and it's a little bit infected. So that is called a cellulitis, OK? So I think we should give you a short course of antibiotics. And you're not allergic to anything as far as you know?
No.
No.
Why is there a picture of Henry VIII in here?
Good question.
Because he's a bit of a bastard, really. Isn't he?
That picture was done by Holbein, but it was copied by my great-aunt. So I know who the artist was. She has died since then.
He was like, I'm going to kill loads of women.
There you go. OK, Anna?
Thank you very much, Anna.
Pleasure. Bye-bye.
Bye.
Big breath in. Point your bum at me and then draw your knees up. The key is to try and remain as relaxed as you possibly can. And the way to do that, I always say to patients, they laugh, but the way to do that is to open your mouth and breathe gently in and out through your mouth. This shouldn't hurt. Relax. And just... No, keep, that's right, that's right. No, I can't feel anything I missed there. Just stay there. You can pop this, when you're ready, get your breath back and then get yourself dressed. Sit yourself down. So what this is all about, I have to tell you,
Okay.
is the possibility that this might be a cancer being there, not anything else. And the figure that they've chosen is if you go on bleeding for over several weeks.
All right, well, no, it stopped. Now I've been able to go to the loo and it's not bleeding at all. So.
Well, that's very good. So, yes, I agree with your sister.
My ex-wife.
Your ex-wife. Sorry.
No, don't worry.
So that's likely to be a hemorrhoid inside that's bleeding a little bit. If you get a bit of bleeding after you've done the poo.
No.
After you've defecated, and then you're wiping yourself, as you see blood on the paper, that's very likely to be a hemorrhoid.
Okay, well, that's what's happening.
Otherwise, I couldn't find anything abnormal at all.
Okay, good.
So I'm sure the right thing is to wait and see.
Okay.
How are you?
I'm so.
You've had lots of contact with your psychiatrist, haven't you? And I've had some with Vicky and...
I want to talk about that first of all. Hello, they had internal meetings,
Yeah.
which I wasn't part of. I'm frustrated that they just don't seem to listen to me. Nobody is addressing the issues of what keeps me in the traumatic circle. Trauma, and it's me trying to grab things that are there, like the sanctuary, like women's groups, things like that, and try and focus on moving forward. But my symptoms, my trauma, my flashbacks, my nightmares, my insecurities, my depression, my anxieties, this has not gone away.
So you've just got the 2 spots now, have you? And nothing else?
Yeah, this one's only small.
Tibanos has got a rash on his right leg.
My arm has got like real bad.
Right, OK.
So, concern is, it was a mole and now it's changed.
So an itchy patch?
Yeah.
Yeah. Oh, yes, just here.
Yeah.
Yeah.
Come on through, Jeffrey. So we had a chat about this yesterday.
Yes.
Saw you in November, December, when you had this sort of tightening of the foreskin.
That's right.
But you could get it back, and I referred and it got rejected.
Correct.
But since that time, it's got worse.
Definitely.
And what can you do? Can you retract it back to go for a wee or anything like that?
Not at all. There's no retraction at all.
Mm-hmm.
And it's getting a little bit embarrassing because obviously there's no direction.
So does your wee come out in a... Does it spray at all? Or?
Yeah.
Okay. Okay. And has there any skin change on the tip of the penis that you can see?
There's colour change.
There's a colour change.
Yeah.
And when did that develop?
Well, it's been developing since it hasn't been able to retract.
Yeah. Yeah. Okay.
Hi, Glenn, it's Rose. Hello, I don't know what I've done, but my screen has completely turned around.
Let me just try and see what they're trying to do about it. Say that you feel down and persecuted. So many different services, it's difficult to keep track of who does what and what you can expect. They also think that your expectations of services may be unrealistic.
Only expectations I have of services if somebody is offering me something that it actually happens.
Yeah.
Because it's not happened. It's not happened. Okay, now I want to talk a little bit about the gender situation. Okay, I'm going back to Laurel's, right? I was told last time I brought it, I had to wait 2 years to put the application in for the gender recognition certificate. So it's 2 years come now. But when I have to talk to both my psychiatrist there and you, because to go before the panel, I need my GP and I need the psychiatrist agreement letter. So, yeah, are you happy to do that?
I think you should talk to the Laurels first and go because they will obviously know much more about that than me. But if they're saying that the situation is right for you, then yes, I will be able to confirm that.
The second thing, I'm in the position to go forward for surgery, for breast surgery, yeah. But the surgeon that I had the consultation with.
Because you've had a consultation.
I've had one consultation. Okay. She's now sent me away with 2 things that she will require from me. You know, I'm working on my weight loss anyway, and I'm consistently working on that. So that's part one thing. Good. And obviously the second thing would be my GP to say that they're happy for me to go ahead.
I don't see any problems with this, Valentine. OK? All right? So speak to the Laurels about both those things. OK? So we've got a plan there. All right?
Yeah, OK.
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 All right. OK.
Thank you.
Bye-bye now.
Okay,
bye-bye.
Yeah, bye.
What have I done? You did, it went off like that, and then it... Ah, well done. Thanks, Glenn.
So, sorry, Jeffrey, I just need to... Can you see what you can retract yourself?
Yeah, sure. There's nothing at all.
There's a whitish skin change there,
Yeah.
isn't there? Yeah, fine, OK. And let you pop your things on and get dressed. That's OK. I think you've dropped a couple of copper pennies there.
Oh.
Right. Well, obviously it needs sorting out. I think what's going on is something called BXO, which is a kind of skin condition that over time in your sort of age group leads to just the tightening of the foreskin, exactly the kind of symptoms you describe.
Yeah.
And so that needs acting on pretty quickly, actually. Haven't seen a case for a while, actually. BXO stands for balanitis erotica et obliterans, and it causes thickening of the foreskin and depigmentation. This presents with symptoms of poor stream when you're passing urine and pain during intercourse. It's relatively uncommon, we don't see it very often. Medical options are using steroid creams, which sometimes help, but unlikely in cases where they're occurring in older age groups. Usually the definitive treatment is surgery, which is often a circumcision procedure. Does it itch at all?
Every now and again, I get that really it itches inside.
Yeah.
And you can tell it's quite hard skin at the top end.
Try and keep the area dry. The other thing is just to book in for some blood tests. I just want to check your sugar level and a few other bits and pieces because you haven't never really had any blood tests.
No.
So if you take that along to the treatment room, they'll book you in.
Yes.
I'll speak and sort out the urology referral again.
Yes.
See what we can do, but it's obviously it's more urgent now.
Yes.
Remind me, do you smoke at all?
No.
You've never smoked?
I gave up when I was 10.
You gave up when you were 10?
Yeah.
Should I ask how old you were when you started?
About 8.
Were you just trying it or smoking proper?
No. My friend and I used to go down to Central Park in Plymouth.
Right.
Because my dad was in the Navy, so there's 60 a day, so there's cigarettes everywhere.
It was freely available.
So we used to just go into the park with a packet of 10 and a bottle of lemonade.
Then muck around.
And then when I was 10, Steve decided to drag one down, and I thought, no, I didn't like that.
Didn't like it, so it put you off for life.
Yeah, definitely.
OK, well, there we go. All right, Jeffrey.
There's not too many people who say that.
No. I'll speak to you a bit later.
Brilliant.
All right, we'll get that sorted ASAP.
Lovely. Thanks very much for that. Brilliant.
Take care.
Thanks a lot.
Bye.
Hello, reception. Hello, all right. Yeah.
Thank you very much.
Yeah.
Thank you, darling. See you later.
Okay, I've added it on for a phone call, but it can be any time between now and when we close. All right. Thank you. Bye.
And what's brought you here today?
So she has, I can only describe it as a rash on the back of her neck.
Okay.
Which is a lot more fierce and flared than any that we've had before.
Right, okay.
But we don't know what they are, and we can't work out why she keeps getting them.
Okay, and has she been well in herself?
She's well in any other aspect.
Right, okay.
Looks that might be our animals, our 2 cats.
You got 2 cats, have you? Okay.
Put them up.
And do they get regularly treated?
Yeah, this is the thing. At one point, I was getting to the point where I was hoovering mattresses and...
And have you actually treated the house as well?
Yeah, I've sprayed the house.
Let's have a little look at your neck.
Stand up then, sweet. So that's the worst I've ever seen them.
How do you sleep? Are you in a duvet?
Duvet.
And do you have
you wrap yourself up in those little
night-
woolen blanket things?
a night dress or
No, she's been sleeping in her vest and underwear.
vest
recently.
and underwear? Okay. See, I'd say they look like bites.
Okay. Any idea from what?
Could be flea bites. That's what it looks like to me.
Because I've literally stripped everything. I pulled everything out of her room and hoovered the lot, sprayed the lot, and then the cats are defleed every 4 to 6 weeks.
The only way we can do it is, again, suggest treating the house and maybe this blanket as well, really.
Is there anything that I can do to make that go
To
down?
stop it itching, she could take an antihistamine.
OK, well, we've got that at home, so that's all right. Right, we're stripping your bed, we're boiler washing everything, we're spraying the hell out of your room. Everything that lives in your room is dead by the end of it. See, cats, bad idea. Bloody things.
Hello, I'm Dr. Bolam. Right. So, how are you?
I'm good.
Yeah. So tell me what's going on. You weren't living at home, were you?
No.
Is that right? Just tell me a little bit about that.
I used to live in care, and I was with a carer since the age of 8.
Okay.
So then I decided to tell my social worker that I would either run away or you could put me where I want to be. So I ran away from Cornwall and legged it all the way up to Bristol. But I didn't tell my family where I was for like a whole week until
Where were you?
House hopping.
Okay. So what's happening now then? What, social services know where you are.
Yeah, I'm living with Mum at the moment.
Okay. So what can I do for you today?
I have ADHD and I take 80 grams of methylphenidate hydrochloride every day.
Okay.
And sometimes it feels like my emotions get locked away in my head, like no emotion will come out sometimes.
Let me get this straight. Are you here today to discuss this, to potentially change it?
Yeah.
Right. Okay. We need to
Why
think
were
about
you
that.
told to come here though, Leanne?
Because I took an overdose on my meds.
How many did you take?
I took 10 of the 5 milligram ones. So it wasn't like my normal high dosage, but I hadn't had anything for a couple of weeks with my meds.
Okay.
And then I had loads of them.
Let me get it straight. You've been off it altogether for a couple of weeks?
Yeah.
Because you'd run out?
No, just because I don't...
Just didn't want to take it.
Didn't
So
take
for
it.
like 2 weeks you'd had no methylphenidate at all?
Yeah.
And then you took 10 5 milligram ones?
Yep.
So that was 50 milligrams?
Yep.
And what you told me a minute ago was quite often you take more than 50 milligrams in a day anyway. OK, this needs sort of straightening out, OK? All right. I want to see if I've got a letter from your community paediatrician, OK?
Yep.
So what they write is that you should take 50 in the mornings and then occasionally take a 5. What they're saying is in the context of you needing to kind of concentrate.
Yeah.
OK, that's what they say. Now, if you're talking about feeling like you've taken too much, maybe that's the solution.
Yeah.
You take 50 in the morning.
Yeah.
And then you just use these if you... I mean, you're not doing homework now.
No.
Maybe you don't take these at the moment.
Yeah.
Do you need some counselling? Are you under thinking aloud? Do you know what thinking aloud is?
Don't know.
Shall I write that down for you?
Yeah.
OK, it's support for all children in care, all right?
Yeah.
But I would think they should be aware of you. They should be aware of all children who are looked after, which is the sort of fancy name for being in care. OK. And you're feeling a bit better now?
Yeah.
Is that all right? Yeah. OK. It's nice to meet you. So do you think you're going to be staying in Bristol then?
Hopefully, yes.
OK, good.
Yeah.
Excuse me. Excuse me. There's no phones in here, my sweetheart.
David Parfitt, please. Hello there.
Good afternoon.
Sorry about the wait. Come
Oh,
on
that's
through.
okay.
Come on in. Come and take a seat.
Thank you.
I'm Dr. Ahmed. We haven't met before, I don't think.
don't believe we have.
No. How can I help?
Well, here's the thing. My mum died last week.
Oh.
And I've got 50-odd years of stuff to sort out.
Was that an expected death, or?
No, it was... Well, she was 81 and had been suffering, but, you know, it wasn't really expected. I actually found her in the hallway of the house. She was still alive, but only just, and she died 3 hours later in hospital.
And where are the pains? So, I mean, it's still like my legs still feel a bit tingly on occasion.
I've got problems with my knees.
Both of them?
Yeah.
I've had sort of on and off pains in my big toe joint.
This knee's been playing up a lot lately.
It's more when I bend over.
Any numbness or tingling?
No, I've just got pain right down to the fingers.
I don't think I've met you before.
No, I'm
Yeah.
William.
Hi.
Happy, obviously.
OK, so what are we doing today?
I went to the hospital weekend, Monday, wasn't it, with the arthritis. Woke up with terrible pains in her arm, as
Right.
per usual.
Yeah.
Went to A&E for 7 o'clock. As soon as they opened, we like to get there on time. And the usual thing, I mean, Grace keeps thinking they're going to do something drastic, but,
Yeah.
you know, because once she had a morphine terrible, injection in the leg.
Yes.
And I think she thinks they're going to do that every time.
Yeah.
So what they did was give her extra strong painkillers.
Oh, yeah.
So
And she asked me that she was letting you know, isn't it? Oh, that's one, isn't it?
Yeah.
Some codeine.
Codeine,
Okay.
just to say double strength or something.
So you're affected in lots of bits of your body, aren't you?
Yeah.
Got to learn to slow down. Because as
Which
soon
I
as she
have
has a good day,
Yeah.
she's out in the garden and she'll move and pull
Yeah.
things about.
But I guess you've got to do what you've got to do, haven't
just
you?
forget.
Yeah.
You think you're okay
Yeah.
today, you're doing
Yeah.
it, washing big gowns.
So, show me, with your hand, show me which bits are really sore.
Well, what can I say, all round here.
That joint, so
And
that
which?
bottom bit there, yeah?
Yeah, oh yeah.
These bits here.
Yeah, and the other one was the elbow and that.
Right.
Sorry, started
Yeah.
from the elbow and went
Yeah.
right to here, and then all
Yeah.
of a sudden...
I mean, the
Tap the
most
hand.
likely is that this is the sort of arthritis caused by sort of wear and tear, osteoarthritis. But it is, you are quite bulky here, and
I
it
did
is
say
quite
this morning
tender.
to you, didn't I look at that bit?
And your
My
wrist
eyes
is
are going
quite
this way.
swollen, yeah? Does that hurt there?
Yes,
Yeah.
it
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing a different sort of arthritis, OK? Which might need a slightly different sort of treatment.
Right.
OK?
Grace is thought to have osteoarthritis, but when she came to see me, her wrist seemed a little bit unusual for that condition, in that it was swollen and red and tender. And so I thought I ought to rule out an alternative diagnosis like rheumatoid arthritis.
So if you have the bloods done at some point, maybe in a couple of weeks, and then book to see me a week after and we'll discuss the results, I'll give you some of these with paracetamol in, and we'll see how you are.
Osteoarthritis is the commonest form of arthritis. It normally affects the large joints, such as knees and hips. Rheumatoid arthritis affects the small joints of the hand as well as larger joints. The main difference between the two arthritises is that rheumatoid arthritis unfortunately destroys the joint. So it's important to make the diagnosis early so that you can be on medication to prevent that from happening.
There we go, that's gone through to next door.
Right,
Okay.
that's super, yes.
All right, there we go. You
We
take
go
that
through
back.
and
Do you want to put that
that's
back in
it.
there?
Yep.
Put your hand back.
And that's for you to make an appointment to have the bloods done and see me afterwards. Okay?
Right,
Okay.
okie dokie,
Excellent.
that's fine.
All right.
Yes.
Yeah, go ahead.
Dr. Bolam.
Bolam?
Bolam. Is it Bolam?
Dr. Bolam, yeah?
Is it Bolam?
Yes. Is that who you
The
just
lady
seen?
I just saw, yeah.
Let's have a look. What's your date of birth?
16th of July, 1957. 57.
Sorry, 16th of July, 19...
Don't say it loud.
Oh, sorry.
My mum died last week.
I'm sorry.
Yeah.
That's quite a shock for you, isn't it? If you
Yeah, and I kind of...
just popped round to see her,
Well,
presumably, or...
I had a weird feeling. That was the thing. I'd spoken to her the night before, and she was a little bit out of breath. And she was clearly a little bit confused. I don't know. I tried ringing her in the morning, and she didn't answer. That's not unusual, because she's out feeding the birds or shopping, or a very active person. Tried her again after lunch. Didn't answer, and I thought, that's unlike her. And I just had this horrible feeling. I don't know, I can't really explain it. It's just one of those...
Sixth sense.
Yeah. So I went there, and I was so glad I did, because she was still alive, albeit breathing very shallowly. That's such a word. Yeah, and she's, you know, unfortunately, she died in resus in casualty.
And have you... what I find is that you... When you're busy with it all, it's OK, and then sometimes after things settle, it hits you what's happened. Because there are moments that you feel absolutely fine because you're busy, then you feel guilty about feeling fine, then you feel sad, then you know, so it's a whole mixture of emotions.
Yeah.
And I think it's a normal pattern.
Yeah, I'm going through the what if sometimes. I think, oh, what if I'd gone round there that night?
Yeah,
She
the
was
what
clearly in trouble, and I didn't pick up on that.
you couldn't have changed anything. We've all got our time, haven't we? We're all here for a limited time. That's the only certainty, actually.
Yeah,
so,
that's very true.
You know, and actually you acted on an instinct there anyway to go around in the first place. So you got that last bit
I was
there.
glad I was with her, let's put it that way.
Yeah, that's right. That's right.
Yeah.
So, I mean, you'll be... The whole sort of bereavement reaction's quite a process, really.
Yeah.
But come and talk to us about it.
Okay.
We also advise, I mean, and it's entirely up to you, but you can always contact Cruise, which is a bereavement counselling service.
Oh, okay, I didn't know that.
I'll give you their phone number. Sometimes it's helpful to talk to an objective person who's not friends or family.
Okay, that's brilliant, thank you.
Yeah.
Thank you very much.
That's all right.
Right.
Take care.
Okay, thank you. Thanks very much.
Bye-bye.
Bye.
Bye-bye now.
Bye.
Oh, is somebody making coffee?
I don't drink tea or coffee, so...
I think that's a terribly good excuse. I don't know how to boil an egg, I never eat them. I don't know how to cook meat, I never eat it. That would be all right, wouldn't it? That would strike a rather high moral tone, that one.
Laura Smith. Hiya. Come in. Have a seat, all right? Right, how can I help you?
OK, so recently, well, over the last month or so, every now and then I get this horrendous pain. Like, I don't know where it is, but it's more like here. And I can't tell whether it's in the front or in my back. And if I'm quite honest, I got a query of what it is, and this is only because my mum said she had it. She thinks it's gallstones. Because my mum had gallstones, and she had to have, when she was my age, and she had to have her gallbladder removed.
Okay.
But I never told her about these pains, and my mum's saying you've got to go and get it looked.
When did this all first start, then?
About a month ago. I would almost say it's constant because I'm getting like a dull ache in between now, do you know, between the attacks. I can feel something's hurting me.
So it's happening every day now?
Yeah.
Are you normally generally fit and well?
No, I'm bulimic. Yeah.
Okay.
But I am well, but I am a I've been bulimic for like 10 years.
Okay, so what's your diet like at the moment?
I don't binge eat so much, not anymore, but I do throw up every time I eat.
Do you think it's related in any way to having an empty stomach and not having eaten, and then do you think that it's at all relieved by then eating?
Probably.
Probably.
I don't know.
The other thing...
My eating pattern is just so ridiculous. Sometimes I can go 2 or 3 days without eating.
Okay.
And then I can just eat normal, or I might binge eat, or I have no consistency to my diet.
Right, let's have a feel of your tummy then. If you just have a lie down on the couch
Yeah.
for me a second. Let's have a feel of your tummy lower down here. And have you been passing urine okay?
Yeah.
No burning, stinging, pain?
No, not that I've noticed.
Any pain there?
I don't like that.
Don't like it, but not painful, though?
No. Yeah, that's right. More just uncomfortable.
Okay. Right. Come and have a seat again. So, have you been emptying your bowels okay?
I never do. No, I can't have a bowel movement without using a suppository.
Right, okay. So it does sound like it could be gallstones. The other thing would be something like a stomach ulcer. Have you ever had any acid reflux or a feeling of like
I always
acid?
get that. Yeah.
Have you ever told anybody about that?
Well, no, because I always thought that was a bulimic thing. Like, you know, that I just assumed in my head that because I'm eating, throwing up, my stomach's producing acid.
Yeah.
And then I'm throwing up the food, and so I'll have excess acid. So
Which you will do, and that logic makes sense. But the problem is the fact that the acid is then there in an empty stomach, so the acid can be breaking down the lining of your stomach, giving you a stomach ulcer. So start with this, because this could make a difference. If it is a stomach ulcer, this should really help.
Okay.
But what I want you to do before you start taking them is a stool sample. You're not going to be able to do that, are you?
No, it's not going to happen.
The reason being because sometimes there's a bacteria called H. pylori that can live in your gut. Loads and loads of people have it, and quite often it doesn't cause a problem, but it can start to cause you problems with heartburn, indigestion, acid reflux, things like that. So if you manage to
Yes,
go,
I will try.
bring that back for us.
I always try, if I'm honest.
And then make an appointment to come back and see Dr. Pelly, and then he'll be able to look at getting a referral to do whatever tests they think they need to do.
OK, I'll give it a go, thank you.
All right. Have a good week.
And you.
See you later.
Bye-bye.
Bye.
Hello.
Hi, come on, Dave.
Hi. Get out.
So I'm Dr. McLaren. It's nice to meet you both.
Yeah.
Okay.
I'm here with Evan regarding a bit of a sort of ongoing problem.
Okay.
Evan's been on antidepressants, but hasn't been on them for the last sort of 4 weeks. So he's gone back to sort of quite heavily with drinking and smoking.
It's only cannabis.
Okay.
I thought, is there any point? OK, I need to be taking the tablets, but if I'm still smoking and I'm still drinking, what's the point of taking the tablets when they're not going to be doing nothing to me? The problems and everything that I had going on seemed like they weren't getting no better.
You know, it's a difficult situation. He's going away today.
Okay.
I'm going to go and stay with my brother for a week to get him away from Bristol. But we wanted to see if there could be, you know, I don't know if it's counselling, a drug programme. You know, there needs to be something.
Yeah. You've mentioned drugs and alcohol earlier on. Tell me what's going on at the moment there.
When I feel low, I'll turn to the drink, have like a couple of cans, and then where I've had a couple of cans, that makes me feel happier in myself.
How much do you think you drink?
Only 4 to 5 cans. It's not like I won't binge into like spirits and all that. Like, it's just
lager.
Lager, like.
Okay. And drugs as well. So
it's only cannabis. I'm only a cannabis user. I've never touched no other
But
drug.
you've been like that since about 18.
16.
Sort of 17, 18. You know, even though as a family, we still support him and try to do what we can. We don't know where to go with it anymore. You know, where do we go as a family to try and get him the help and support he needs?
You've been in the wars?
I felt
fell down the stairs.
Oh dear.
Yesterday I was cycling, and then 26-ton of lorry come in. I was in this blind point office. I was on my side.
Oh gosh. I'm running down the escalator and I just tripped and fell.
And in the end, he sort of hit me really bad. Then I just pushed me off my bike.
Yeah.
My bike just got crushed.
Yeah. Because I broke my ankle bone down there, and I also damaged my knee.
All it is, my hand.
Yeah, what did you do?
I literally fell on it really hard.
My ligament of my little finger went.
Yeah. And have you injured anything else?
Mainly my muscles, my neck, and my shoulder.
Yeah.
I think I've done something to my back.
Right, OK.
I twisted my back on Monday because I work up the hospital.
OK.
And I had an old lady, and I tried to make her roll on her own, and she didn't.
OK.
So in the end, I sort of ended up pulling the sheet out from under her.
Yeah,
And as I went like that, my back...
Right, don't do it again.
No.
OK, all right.
And over the past couple of months, I've been getting shooting pains down my back and in my leg, and it's sciatica.
OK.
But it goes, then it comes back.
OK. Has that changed at all?
No.
No. So this is something different that you did?
Yeah, it was just on, like I said, on Monday, I was like up and I was rolling this lady from this side of the bed. And I went like that, pushed her, and I was holding her up, and as I was holding her up, I could feel me like pain in my back.
Sounds very much like you've just sort of strained a muscle in your back, doesn't it?
Thank you.
OK?
Yeah,
Let's just have a... yes. Let's have a little look, OK, just to make sure it's not anything else. So it's all on this, slightly on this left side?
It's on this side. It's always on
OK.
my left side that the pain is.
OK, all right. And it's turned around here, is it?
Yes.
OK, all right. I mean, you just need to be really careful lifting patients and stuff, don't you?
Oh, yes.
OK.
Oh, I know that.
Right, OK. I mean, what's going on about your sciatica?
It's my age anyway, isn't it? That's what I'm told. And I'm overweight.
Yes, that won't be helping.
No, when my doctor's left and he said, you're very obese.
OK, that was a polite way of putting it, wasn't it?
And he said, you have to do something about it.
OK, all right. So are you doing it?
I'm trying, but
it's just
now I'm
It
retired,
is hard.
I'm starving all the time. I mean, I'm continuously, not being funny,
I thought you weren't retired, you're working at the hospital.
Yeah, I work only part-time.
Oh, I see, OK.
But,
have you got are you doing Weight Watchers or anything like that?
No, because, see, I have depression, anxiety and panic attacks. And I'm having major panic attacks again. They've started up again really badly.
I just wonder whether I should refer you to Weight Watchers or anything. Would you like
I went up to the gym once and...
once doesn't
No, I had a
usually
panic
work.
attack. Major panic attack. But if I get the hang of it, I would like to go again
Would
to
you
the
like
gym.
me to send you back to the gym?
Yes, please.
All right.
And I will go.
OK, all right.
The thing is, I think because you're depressed, you eat, and because you eat, you're overweight, it's a vicious circle.
It's a vicious circle, absolutely.
And I've now got into it that I can't get out.
Yeah, no, that's right.
But I look at people going to the gym and I think, I'd love to go. I really would.
OK, all right, well, brilliant. Let's see if
and
we
I will
can,
go this time.
Good, OK. Let me just...
I've got my tracksuit bottom ready.
Oh, you are just going to be on it, aren't you?
Oh, yeah.
Good morning, can I help?
Hi, my daughter, she's got conjunctivitis. She needs to see the doctor.
I can take your daughter's date of birth, please.
It's the 30th of January, 2011.
13th of January.
14. How am I messing it up?
So, what do you think we should do?
Give me some sort of help.
OK. Did you have any particular type of help that you thought would be useful?
I don't know. It's hard because I find if I'm active and I'm doing stuff, it takes everything away off my mind.
So what happened with Rhodes? Have you got their contact number?
Have I got a contact number
For Rhodes? In terms of support, because it looks like you're looking for a bit of support, they actually quite like the call to come from you. Yeah. Because I guess
instead of them coming to me.
Yeah, well, instead of me saying, you have to go and see them, it shows that that's something you want to do. If you take ownership. Yeah, exactly.
Another thing as well, whilst I'm here, is I've run out of my antidepressant tablets.
Yeah. What do you think we should do? Because it sounds like you weren't that keen to take them. Do you want to try them again?
It's not the antidepressants. It was more of the diazepam that was keeping me happier and more bubblier in a person.
Diazepam, I'm quite reluctant to prescribe. The reasons being are it's very addictive, and I guess you've showed that you've had some difficulty with impulse control and with substances anyway. So I feel like I wouldn't be doing you any favours by giving you more diazepam.
Yeah.
But we could think about a different antidepressant to see if that has more of an effect if you wanted to.
I feel like the antidepressants that I was on weren't actually doing nothing.
Okay. Well, let's try something called sertraline. You've not had that one before?
No.
Okay, if I give you a couple of weeks' worth, and then when you come back, you
make an appointment to see a ring doctor or whatever, yeah.
Yeah. I think it's good that you've come in. I think that we do need to make some changes. Some of them will come from getting the right support, and some of them are things that you know...
I need to do myself, yeah.
OK, lovely.
OK.
Do I need
Thanks
to
so
sign
much.
it and that?
No, you just take it into the pharmacy. You don't pay because you're on benefits anyway, so...
No, that's what I mean.
OK.
I've got tick the box and
Thank
sign
you.
at the back, haven't I?
Yeah.
Right, thank you.
Now, Ken, you're here for your diabetic bloods, yeah?
Yep.
How are you feeling today, all right?
Yeah, not too bad.
The sun's out today.
Well, they say sunshine on the righteous, don't they?
Exactly, they do. Don't know what happens all the other days in Bristol, but there you go. What are you doing today? Anything else?
I'm up at the hospital because I'm a voluntary driver out there.
Oh, OK.
That's Southmead.
What, one of those drivers in the little mini golf things?
No. I've been driving for mental health and North Bristol for 26 years.
Wow.
You know.
So do you drive the patients home and
I
stuff?
drive them home, and also with mental health we used to have loads of groups outside. But of course with cuts, all those things are gone.
Yeah. So you've been volunteering for that whole time, have you?
Yeah.
Oh, right. Don't they have a cut-off date as well as an age? I'm sure somebody come in and said they had to stop because of their
they
age.
say they're in their 80s, you know, as long as you can walk.
OK, then, that's you finished.
Right, so...
All right, then, take care. Bye now.
All right, Mr. Newton?
Yeah, thank you very much.
OK.
Go on.
Bye-bye.
Bye.
Right.
Yes, all right, well, thank you for looking. No problem. All right, take care. All right, bye.
Hi, can we help you?
Busy. I have been experiencing some nipple tenderness.
I've started like cutting stuff like that again.
And do you find the cutting's a bit of a release for you?
It does, but I mean I used to work for the ambulance service, so I know it doesn't help. You all right?
Yeah.
Oh, do you want paper towel as well?
My legs feel a little bit dead. It just feels weird when I walk.
OK.
Thank you. I think you've had the 10 minutes now, more actually.
Don't worry. The 10 minutes is only a guide. It's more important about making sure that we manage you as a patient effectively.
If you feel pushing, that's fine, right? If it's sharp, then tell me. Can you feel any of that?
Let me have a look at your hands.
Not good, no skin.
They're a lot better than they were, though.
No, the rest of my body, I've got no skin left.
I know it's you taking your skin off and regenerating it, but it looks a lot better.
I need some more.
You have to some more.
Let me have a look. But you did not enough of my whole body.
Give me your date of birth, sweetie.
23rd of the 10th, 55, spring chicken.
Juliet, yeah?
Can have a seat down there. How you doing?
Well, I cut my hand the other day. I'm really sorry if this is like a waste of time and everything, but
Okay.
I'm worried. Right, I was doing a washing up, had
Yeah.
my hand in a pipe class, went across, cut it, went to A&E. As I've been working and everything, because I've had to still go to work, I think all the cuts open.
Yeah.
I don't know what I'm wrong with, but when I'm holding it, I can't really lift my fingers up, and I don't know if I've damaged something. It just got me
Okay, worried about it.
really worried because I need my hand
Yeah,
to
of
do my
course.
job.
You right-handed or left-handed?
Right-handed.
Okay. When was the actual injury?
Wednesday night.
Wednesday night last week?
Yes.
Okay, and so you went to A&E straight away after that?
We went to the walking centre, but yeah, A&E.
And you were saying that you were washing...
I was washing, I had my hands inside a pint glass and it
Yeah.
broke and I
And that's
twisted it.
when-
Yeah.
okay, fine.
If I try and force it up,
Okay.
it's really like I shouldn't be forcing
Just
it.
show me. Just show me what you mean.
So if I just do it,
Is that your wrist as well as the fingers?
No, I can hold it on.
But you can't get the fingers up. Okay, let's have a look. Let's put your hand down.
Because I've got to keep working everything.
You're
I fix shutters and doors and drive stuff.
Can you feel me touching your fingers along there?
Yeah.
Same as the other side?
If it was a bit faint that side, but yeah, I can feel that.
Just squeeze my fingers for me. What's stopping you in here? Pain? You feel the stretch, or is it that you physically can't do it? Okay, you can relax again.
Ouch.
Push up against my finger.
No, I can't even, no. That one.
Avneet, cool? Hi, come in. Right, so what we're going to do today is we're going to start the vaccinations, OK? So today there's 3 injections and 1 medicine in the mouth. OK. So the one in the mouth is to protect the lining of the gut. OK, so because a lot of babies get diarrhoea and vomiting, they end up in hospital really dehydrated. A side effect, which I've never seen, but I'll just tell you about, is a problem with the guts, strangely enough, OK? The other 3 injections we're going to give in her legs. One of them is the meningitis B, and the research shows that it's quite likely she might develop a temperature with that one. Buy yourself some paracetamol, the brand name's Calpol, and that should be enough just to settle her temperature. So I'm going to draw up the vaccines, yeah? Oh, bless her. Are you feeding her yourself? Oh, wonderful. So that's what she's waiting for, isn't it? Oh.
So if I hold her, she's going to cry.
Of course she will. Of course she will.
You're scared of
I'm
them.
more scared of it than she.
Oh, bless you. I know, it's
Okay.
not milk, is it?
Okay. I heard you.
Right, hold still. All done. You all right? Yeah. Oh, do you want paper towel as well? There we go. Oh, you're still going? Oh, bless you.
She's all right.
OK, so make an appointment on the way out for 4 weeks' time, baby clinic. That's all right. You can stop crying now. We're finished. That's all right. See you again. Bye-bye.
Thank you.
All right, thank you.
Just need to put my baby's 4th week injection.
You just came in with that cute little baby. I hope you feel really horrible making her have an injection. Did she cry?
Loads. Yeah, even the mother cried.
Do you know what? I never used to take mine. I used to make my husband take them.
Yeah.
And do you know what? He found the best way to get the heat out of it? Get one of the small cans, put it in the fridge,
Yeah.
and when it's had it done, just rub it on it. Just takes the heat out of it.
Okay. Thank you.
That is not looking that great, is it? It's looking a bit infected.
Does it?
At least it's dry.
Okay.
And this one. Sorry.
It's all right, I just don't want to look at it in a second.
Looks quite deep, isn't it? So I want you to leave that there. I'm going to get one of the nurses to come up so they can sort out a dressing for us.
Okay.
And then I'll talk to you about what I think we should do about the actual thing itself. I'll be back in a second, right?
Thank you very much. Stupid problems to have.
He always get up air, very itchy on my legs as well.
Basically, his ear keeps splitting open.
Okay.
I was given some steroid cream, and it seems to not be working anymore. Oh.
It's so greasy.
One of the most common causes of itchy skin is dry skin. So the more you moisturise, the less itchy your skin will probably be.
Yeah, just slap it on, I don't care.
So you're not getting any weeping or anything like that in your
Do you know what?
legs?
It's not even the cream you're putting on. Do you know what it is? It's the touch.
Use it once a day sparingly, the gel.
I don't think this is any rash to be worried about, okay? What I would advise is just make sure baby skin generally is well moisturised, okay?
No, hold that. It's your medicine.
It's like a mayonnaise bottle.
Yeah, don't want to put that on your chips.
Mr. Arif.
Thank you very much.
You're very welcome. Just take a seat. How can I help?
Now, these blisters come on. Here, here. And somebody told me that you can get it plaster from the surgery or something.
No, you would just use cream for those. You wouldn't use a plaster for those, yeah.
I punctured the bloody thing.
Oh, yeah, yes. I don't think that's such a good idea.
Isn't it?
No, you could introduce infection.
Oh, I see.
And then it could flare up. What do you puncture them with?
A sewing needle.
Sewing needle, yeah. No, because sewing needle would not be sterile.
Oh, no.
So it might be clean, but it wouldn't be sterile.
I usually put it under the hot water tap. And
well, that's good, or boiling water, but still not a good idea.
Right,
No, this is a form of inflammation of the skin called Pophylex. It's a type of eczema. Used you have eczema in the past? Is that something you've had for many years?
I had eczema in 2011, actually.
Was that the first time?
First time in my life.
You can get eczema at any stage. What brought it on, do you think, in 2011?
I have no idea, actually.
It just came. What I'm going to do is I'm going to give you a powerful steroid ointment. Now, ointment is rather sticky and gooey, so I apologise for that. But the reason I'm giving it is that the absorption of an ointment is much better.
All right.
So I want you to use those on all of the blistering areas.
Right. Thank you very much.
Good. You're welcome. Nice to see you.
Bye-bye, sir.
Bye now.
What's going around in my mind is whether this is to do with pain that's stopping you doing this, or whether it's deep enough that you might have cut something that needs more attention, right? And I'm not sure is the honest answer.
Okay.
So I'm going to have a chat with the on-call plastic surgeons about this, just to see whether they're willing to have a look at it today and see what they make of the function, right? Is that going to be okay for work-wise and stuff? You're looking a bit worried.
Fine.
I think it's...
Pain and it's pretty deep. You don't think it's a tendon.
Well, that's the reason why I'm going to ask them. And they're going to say one or two things to me. They're going to say, well, maybe it's just inflammation, see how it goes. Well, then we get you to come back, in which case I'll come down and I'll let you know either way, right?
Okay, brilliant.
Or they're going to say, well, if you're not sure, we'll have a look. Okay. And then they'll assess it. Okay, we've got a nurse downstairs who's just going to clean this up for us. So, do you want to come with me?
Yeah, brilliant. I've got a second, just got to get that out so I look cool.
That's all right.
Hello, sweetheart. Where have you been?
I've been fishing around.
Have you?
Yes.
I do miss you when you don't come in, but I know that you're well, so that's okay.
Thank you.
Oh, hi there. My name's Mr. I'm one of the GPs from Farnham Road Surgery. Can I talk to you about a patient, please? A glass broke while he was doing the washing up, so he's got a laceration to his dominant hand, his right hand. I can't tell how deep it is, but it's quite granulated over the top. So I don't know whether he's done any sort of tendon damage underneath that or whether this is just because of the inflammation from the cuts. I was wondering whether you'd be able to have a look. How quick should that referral be? How urgent should I put it? OK, fine, that's perfect. Thank you, cheers, bye, bye. So basically, I sort out the referral, which I'll do today, and we'll fax it off to them. In the next 2 weeks, if you haven't heard from Plastics, then about a clinic appointment with them, then I want you to let us know.
OK, like you say, it's just all cut up, isn't it?
So then the thing with this is that if they review it and they say to you, you know what, we're really not worried about this, then the next thing will be to make sure that that stiffness doesn't remain as bad as it is now. So they might send you some physiotherapy. So there might still be an impact on your work for a little while to come. Maybe not as bad as having to take the whole time off.
At least I'll be able to drive and do something.
Yeah, so we'll have to figure that out as we go along, depending on what they make of it. But that's your sick note, and it's from today for 2 weeks.
OK.
I'd shake your hand, but I don't think I want to cause you any more pain. All right, take care.
No, seriously, thank you very much.
Take care. See you, bye.
It's Dr. Hyder. Come through and have a seat.
Thanks.
Are you Mum?
Yes, I am.
How can I help you today, Cohen? I know you've had some back pain, haven't you?
Yeah.
When did it all start?
The school phoned me to say that he had this severe pain in his back.
Okay.
And if I could drop some paracetamol down, but it just got too bad for him. He was crying in pain, and then he still got it. It's just kind of come out of nowhere.
Yeah.
It's just that he's cried with it, and that's not like him.
Yeah, yeah. So how did it start when you were at school? What were you doing at the time?
I now got on a coach. And that's when it started, but I don't know how
The school, was that the school bus? Yeah, okay. So in the morning, yeah, and then was the pain bad at that point, or did it get worse later?
It got worse later on, and it just stayed like that.
Okay, and whereabouts in your back does it hurt?
It's around here.
The middle bit of your back?
Yeah, and then lower down up to like there.
All right. Any problems going to the toilet to wee or poo?
No.
Is that normal? Yeah. Okay. And any numbness or weakness or tingling, like a strange sensation in your legs at all?
My legs feel a little bit dead.
Which one?
Both of them, but they're just down here.
Okay. All right.
It's
And
a little bit hard to walk, but
is it because you've got pain walking, or it feels numb when you're walking?
I don't really know. It just feels weird when I walk.
Now, would it be all right to examine your back? Yeah. Okay, your mum can sit on there and then you'll be with him as well.
You sure? Yeah. Okay.
Back pain can be a symptom of something quite serious in children. Most commonly, it's because of a muscular problem or a bone or joint problem in the spine, but more worryingly, it could be related to infection or even something as serious as a tumour. So I'm going to just test a few things with your arms and legs. Are you okay sitting for now? Yeah. Can you put your arms up like this? Stop me from pushing you down. Okay, stop me from pushing them up. Put your arms like this. Push me away. Pull me towards you. That's fine. Okay. Is it okay if I just get you to take your trousers off?
No.
Okay.
Take your trainers off. She's going to need to. She might feel your feet as well.
Yes.
I'll get you to push your feet, so you need to take it all off. Okay. He's ready.
Okay. So if you can lie down for me on the bed, I'm going to just touch your legs to start with. Can you feel me touching you?
Yeah,
Is it about the same on both sides or different?
it's the same.
Now if I can get you to just sit with your legs hanging over the end. I'm just going to test the reflexes in your knees. If your child is experiencing back pain, the serious signs and symptoms to look out for are numbness, weakness and tingling of the arms or legs, and any bowel or bladder problems, so if they've lost sensation when they're going to the toilet.
Does there seem to be anything?
So from examining him, everything looks to be okay.
Yeah.
It's a bit unusual to have the pain and the numbness, though.
Yeah.
So I think for now, because the examination's normal, seeing how he goes over the next week or so with painkillers would be reasonable.
Yeah, okay.
And then I'll book him back in to see me and then re-examine again and see if things have got better.
Yeah, that's fine, no problem. Okay, thank you. Okay. Right.
Okay, so did you hear what I was saying to your mum? Things seem to be fine from examining you, but I'd like to speak to your mum next week just to see how you're getting on. Yeah, and if you know better, I'll get you back in and we'll take another look at you.
Good.
Okay.
Okay then.
All right,
Thanks very
take care
much.
then.
Thank you.
Bye-bye.
Bye-bye.
we go, love. If anybody's got an appointment, you can use the self-check-in screen on your right-hand side.
If you've got an appointment, please use the self-check-in machine.
Has anybody else got appointments? Can you try and use the self-check-in?
If anyone has an appointment, please check in on the self-check-in.
Hi, Jin. Come in. Hi, I'm Dr. Sheikh. Have your seat, please. Right, how can I help you today?
I have been experiencing some nipple tenderness. And I'll be honest, about maybe a month, maybe 2 months, I had a little bit of discharge. And then it went away.
What colour was it?
It was sort of a creamy colour and then it went slightly bloody.
Did it?
Yeah. But because it hadn't come back and it wasn't spontaneous,
okay.
I sort of didn't worry about it. But the last, I'd say, probably week, my nipple has been quite tender.
Which one?
The left.
And was it the same nipple that you had the discharge to? Okay.
And I had discharge this morning.
So creamy in the beginning,
yeah, and then
with a little bit of blood.
And then it went
was
slightly
it fresh
clear.
Blood?
It was more like a bloody discharge, but I only stopped breastfeeding in January, so I wasn't sure whether it was connected or not.
Okay. Did you have pain at that time?
No.
No pain?
No, the pain's only been really in the last week.
Did you do any self-examination to feel for any lumps?
I've had a feel, but not. There's nothing that I have felt.
Okay. Any family history of any breast problems or breast cancer?
On my dad's side, there was breast cancer.
And who had it?
His sister.
And how old was she?
I think she was in her late 40s.
Late 40s.
Yes.
Okay. We'll have to examine. Yeah. So if you can take your t-shirt off and your bra off. So just tell me when you're ready.
Okay.
Yeah. Okay, ready?
Yeah.
Right, I'm going to examine your right breast first, okay? If you are in any pain, just let me know. So there's no been any discharge from the right?
No.
Show me your hand, just try and relax, yeah? Okay, and it's not tender as well?
It's a little bit tender,
but
yeah.
not much. Okay.
That's tender.
That's tender. If you can give me your hand again, just relax, yeah? I couldn't feel any obvious lumps. Okay. I can't feel any lumps under your armpits as well. Okay, get dressed and just you can come and sit here when you're ready. Okay. Now, with these symptoms, were you thinking about anything?
I thought maybe it was an abscess in the milk ducts because of the breast, or stopping the breastfeeding and stuff. And I also wondered if it's hormonal.
Sometimes when women breastfeed and they stop, sometimes they experience milky discharge. Yeah. But we do worry when it is blood with it.
Okay.
There are quite a few non-cancerous reasons, for the milky discharge, which you rightly said. But I would still suggest we refer you to the breast clinic. One, because of the family history, and second, because it is on one side.
Okay.
So what we normally would do is we refer under 2 weeks,
Okay.
which is a cancer referral.
Okay.
I can't feel any lumps,
Yeah.
so that is reassuring. But please come back because we need to explore the other reasons.
Can I come back and see you? Yeah. Okay. All right. Lovely. Okay. Thanks
All
very
right.
much.
Take care. Bye-bye.
That's lovely. Thank you.
Come and have a seat. How are you today, Jenna?
Not too bad. Problems with my left foot.
Okay.
I've been to A&E.
Yeah.
They reckon I've torn my tendons.
Oh, I see, okay. Now, this all happened in April after you tripped over your dog, is that right? Okay. Pop your shoe off for me.
It's the only shoes I can get on.
Is that tender?
Yeah, very tender there.
Any pain underneath the foot?
No, I just get a burning feeling.
All around the top there where I was pressing?
Yeah. Oh, yeah, that's where all the all that bit.
Okay. Because you're getting ongoing pain with this, I'm going to refer you up to the orthopaedic surgeons for them to have a look at this. They may want to do further imaging to have a look and see what's going on. Does that make sense? Because for you to have pain ongoing since April...
It's ridiculous. It is getting ridiculous now.
We need to get
I'm struggling.
In the interim, I'm going to give you some pain, some good pain relief. Which pain relief do you want at the moment?
I've been taking everything. If you can get my hands on that. No.
Cocodamol?
Yeah, I've been taking paracetamol, ibuprofen.
I'll give you some more cocodamol because that's an excellent painkiller. The thing with cocodamol is it can constipate you. That's one of the main side effects.
I suffer big time like that anyway.
When you took the cocodamol, did you have a lot of trouble with the constipation?
Yeah, sometimes I can go 2-3 weeks without going to the...
Gosh, okay. What I'm going to do then, when I give you the cocodamol, I'm going to cover you with a laxative as well.
And also I'm going to put my hands up. I haven't been taking my insulin because I haven't had none.
Okay, so you've got 2 liquid films in the eye, 1 water and 1 oil, right? What's happening here is you've got a little ball of fluid just underneath.
Yeah, it feels like fluid, yeah.
So basically, that's a little bit red around this area on the right-hand side. After that, we clean up the area, and then I just slice it off at the base here. And that's it, really. If this doesn't work, then I want you to come back to us.
There'll be more time here than we are at home.
Come and have a seat down there. So how is it?
It's alright. It's not so bad as it used to be.
Yeah.
I've just been cleaning it much more regular. Obviously today I've had a bath.
It's still
so
pretty bad, though,
yeah,
isn't
it's
it?
still bad. But...
Did we decide on taking out the whole nail or leaving a strip in the middle?
Yeah, taking a whole nail out.
Okay. And have you had local anaesthetics before?
Yeah.
Like you're going to the dentist, no problems with those? No. Okay. So the idea is, if we take this nail off and it grows out wide again, this whole situation might come back again, where it's all inflamed. So we put a chemical here called phenol, which effectively burns the bit where the nail grows on that side. So hopefully it will grow out not as wide, so it's less likely to cause you problems, yeah? And then take everything off, dress it. You've got to come back tomorrow for a dressing appointment.
Okay.
Is that going to be all right?
That's fine by me.
All right, so this is the consent form. There's your details there. All right, so it's a reasonably low-risk procedure, but there are risks, especially with the toe when it comes to infections.
I stubbed my toe like 2 days ago, and that hurt.
That must be horrendous.
So...
Yeah. It hasn't happened to me yet, but there is a chance that it doesn't grow back at all.
If it doesn't grow back, that'd be perfect.
Yeah, you prefer it.
it.
If you've got any questions, then fire away. Otherwise, if you're happy, sign and we'll get started. You can come and see me. I'll take distracting, screaming, swearing, whatever you like, as long as you keep the toe really still, okay? So first scalp straps coming. You all right?
Mm-hmm.
This is a bit that you'll know if you can feel it. Okay, so just tell me, can you feel any of that? If you feel pushing, that's fine, right? If it's sharp, then tell me. Brown, isn't it?
And also I'm going to put my hands up. I haven't been taking my insulin because I haven't had none. I'm diabetic as well.
Okay, Johnny, that's massively important. Insulin.
I know it's massively important. Yes. And I had it on repeat prescription at the pharmacy down by me.
Yes.
Then they went for a stage where they can't get a hold of the one that I was on.
So you haven't had your Lantus since last September?
Yeah.
So it's been a year.
Me and doctors, I don't like coming down the doctors unless I really have to.
Okay. I'm going to give you a blood test form. I want you to get an urgent blood test done, okay? I want you to try and get it done today. Yeah. I'm going to book you into our diabetic clinic with one of our diabetic doctors because they need to have a look and see what's going on with your diabetic control. Does that make sense? The risk of uncontrolled diabetes are heart attack, stroke, you know...
I've already had one heart attack and I've already had a mini stroke, which has affected my sight.
So that puts your risks even higher. So let's get this sorted. What I'm going to do is I'm going to squeeze you in with the diabetic doctor next Thursday. What I want you to do is I want you to record your sugars 4 times a day, okay? So before breakfast, before lunch, before dinner, and before bed. And bring those readings in when you see Dr. Nanda next week. He can then have a look at it and decide what insulin regime we should get you back on.
I will go, definitely.
Superstar.
Lovely, thank you very much.
No trouble, lovely to meet you, Jenna.
Thank you.
Bye-bye now.
This is just normal cream, okay? It's just to protect your skin on the other side while I do the chemical bit. So it's going to stay numb for a few hours, but you should be able to walk and still wait better because you can still use the ball of your foot, so that should be all right. All right, Judy's going to dress it for you. So the really important thing from today is that it stays completely dry once we've done the dressing, because if you get it wet, then the chances of it getting infected are much higher. You'll be able to use nail polish again in no time.
Yeah.
OK, darling, there you go.
Thank you.
Good stuff. Take care, OK? No problem. I hope it settles.
I'll see you now.
Take care. See ya. Block worked really well on that one.
Hello. Mrs. Hollis.
Yes, hi, I'm a medical student. Nice to meet you.
Right, here. Do you want to take a history?
Have you got a headache? Yeah.
The average consultation time in the UK is 12.5 minutes, and that means before you even start your surgery, you know that you're going to overrun.
Hayden Ford? In the GP training programme, we learn time management techniques and aim to deal with problems in 10 minutes.
Felicity!
Increasingly, we're having to deal with more complex medical problems that require far more than 10 minutes to really get down to the bottom of.
It's like we play darts on a Wednesday night.
So sorry to bring you back, because we're a bit short of time today.
I'm prepared to bend the 10-minute consultation rule when I have a patient in front of me that clearly needs more of my time. If we deal with 4 or 5 problems in 10 minutes, then it doesn't work. We don't want to miss anything. We want to make sure that we treat it effectively.
Of course,
Does that make sense?
course.
You've got a good going over today, believe me.
Bye. Take care.
Gosh, the clock pressure's huge.
So that's about 30 minutes.
I know, that took me absolutely ages.
Yeah, but you went through everything, and you went through it very well and very methodically and logically. You do have to live with risk and uncertainty. But if you can say, do you know what, I feel comfortable, I'm not going to worry about that. If you're going out and going home worrying about a consultation, you maybe should have done this or that, it's often worth just giving the ring and getting it done or something. And you can't have that number of things playing in your mind.
No, get mad.
When you go back.
That'd be great. Yeah, that's fine.
Come on in.
Hi.
How are you getting on?
Yeah, good.
Perfect, good. Let's talk about the rheumatologist. I know we didn't really mention that last time we caught up. You last saw the rheumatologist in August, didn't you, actually? Not too long ago. So how are things from that point of view?
Yeah, I would say it's mostly fine. I think my knees and feet do have the tendency to still swell occasionally. But I think apart from that, I think everything is still very firmly under wraps.
Good, okay. And just reading from the letter, I think the good thing is she didn't find any evidence of any what we call active inflammation in the joints, which is obviously the thing we worry about with arthritis because that can start to kind of damage the joints. So thankfully that's not the case. So long term, going forward, I don't think this should have any implications in terms of your mobility, in terms of the actual structure of your joints. I think really the priority will be to try and help you to manage your pain. Your rheumatologist felt that there were some elements of your condition that were more in keeping with a condition called fibromyalgia. I don't know if that was explained to you and sort of chronic pain. Polly was diagnosed with a condition called juvenile idiopathic arthritis, which is a type of arthritis that affects young people. About a year ago, she was also diagnosed with a condition called fibromyalgia, which is similar and can cause pain all over the body, mainly in the muscle groups. Were you referred to a psychologist?
Yeah, I started a pain management group Friday just gone.
You just recently? Brilliant, okay. Psychotherapy is no longer really a controversial method of treatment for chronic pain. A number of different types of therapy, including cognitive behavioural therapy, or CBT, are often used as well as meditation and even hypnotherapy. And really the main thrust of all of these treatments is to try and help change patients' perception of their pain and change the way in which it affects their day-to-day life. So it's not something, unfortunately, that will kind of go away magically with the things that we're giving you, but hopefully with the psychotherapy and the special sessions that you're going to be having, that will give you the kind of tools to manage it a bit better. And just a bit more about yourself. Are you working at the moment or no? Okay.
College.
You're at college. Fine. Okay. And how are things with that?
It's all going pretty well so far, yeah.
Yeah. Okay. Good. Good. Okay. So I think we carry on going as we are. Obviously, hopefully you get benefit from the sessions. If you need our help with anything, if you feel that things are kind of going back downhill again, you can always chat to us. Were there any sort of questions that you had or any concerns?
No, I think we're all good.
Good.
Awesome.
All right, take care.
Thank you very much.
All right, bye-bye.
Bye.
Hi there, Leanne. Come in. Right, what can we do for you today?
It's just a couple of quick things.
Yes.
First one to get over really quickly. These little skin tags.
Yes.
How can I get them off? Because I'm getting loads.
Let me see.
That one's the main one, the big one, which is it gets caught up in my neck and rubs on it, and I've got a few under my arm and that.
Okay. Because they're very small, you twist them and then you can sort of cut them off. Sometimes put a little bit of local anaesthetic in. It is a little minor operation.
Yeah.
But it would be very quick.
It's quick, yeah.
And what we do is sort of snip it off and then we cauterise the base just to stop it bleeding.
Yeah.
And that's pretty easy to do.
I want to do it, but I'm a bit wussy, so...
No, don't. Yeah, it's not a good idea because it will. You could do it, but it will just.
Yeah.
Right. Okay. So
that's the first thing.
Okay, I can do that for you.
The other thing I need at the moment, because I'm going through trauma therapy a lot, and it's brought a lot of problems back up.
Yeah.
And at the moment, I'm getting very, not just anxious, but I'm getting very angry as well.
Okay.
And I'm struggling to control it.
Yeah.
And I was just wondering if there's anything that I can be given or get or something to try and taper it down. I get also quite emotional, which isn't me. I don't cry for England, so just very...
And the therapy sort of sometimes is making that sort of come out, do you think?
It is, yeah. Something happened in my past, and obviously now it's been all brought back up.
Okay. And sometimes that's what therapy does. And there are things we can do to try and help reduce some of the anxiety. It may not get the anger down, but if you make you less anxious and sometimes a little bit sort of more stable, then you can sort of cope with the therapy.
Because that's what's happened. I think I'm getting so high up, I've started like cutting and stuff like that again, which I haven't done for months and months and months.
And you don't want, you're not going to do anything more serious than that, are you? There is something not right with this.
Yeah, I'm having a problem with my printer.
Do you want me to just shut it off and then turn it back on?
Where did that go to?
I'm just fighting with my printer.
No, it's definitely not working, that.
I think I'm getting so high up, I've started like cutting and stuff like that again, which I haven't done for months and months and months.
And you don't want, you're not going to do anything more serious than that, are you?
I think you've always got those feelings there anyway. When you're depressed and everything's going on, that always there. So, but
You have them. Have you done anything about them?
No, other said than
The cutting. Yeah. And do you find the cutting's a bit of a release for you?
it does. But I mean, I used to work at the ambulance service, so I know it doesn't help, you know. But at the time, I think I'll get to that pinnacle where you're like, what do I do? And you know, as I said, that's when I do it. And yes, it helps, but then of course after you've got the guilt. So
it doesn't. It's a short-term relief, but And it's very difficult to sort of explain that sometimes to other people. But I can completely understand that. What I would say is that, you know, if there is anything else you can do just before that happens, like ring or talk to somebody, you may not be able to, then try and do that rather than cutting yourself. Obviously, you know, it's a difficult period. And what I'll do is I'll give you one of the antidepressants that is used to help with anxiety as well, to see if that then can help with it. Is that all right?
Thank you very much. Yeah, it'd be lovely.
There's definitely a stigma attached to self-harm, and people generally don't want to talk about it. But if we could break that, we can give people help. And we know that teaching people to deal with those crises of emotion can stop them doing things to harm themselves and sometimes stop them committing suicide.
Everybody thinks I'm quite like a bubbly person and talkative, and you just think you don't know the half of it behind closed doors, isn't it? But I'm getting there.
It's a facade, and you've probably had years of practice of putting on a facade so people don't know.
Big face.
And a happy face, but underneath you're just sort of crumbling and you need a little bit of help. If things get really bad, one of the, I don't know if you've ever done it, but Samaritans are very good. And just ring that. They make no judgments. They give somebody to talk to. And sometimes just having that ability, and it's not somebody you know, and it's not somebody related to.
It's not family and not
friends. Takes a lot of that away. And they're very good at doing that. I mean, it has helped a lot of people. And sometimes you just need something to stop you making that action. And this keeps you sort of stopped long enough for it to pass away. That's what you need. You need it to pass over, because otherwise you have to do something to get you through. And what you've learnt is, if I cut, then it goes away, but it comes back, feel guilty, but it's and you need to unlearn that.
But it gets rid of that first.
It gets that first impulse.
Yeah, you sort of feel on the edge of a hill and you think, oh, I've got to do something.
Yeah. But if we can get, and once you can stop that, you know, then, but it's a difficult time for you, I can appreciate it.
And sometimes that's all it needs, isn't it? It's just that little bit of extra help. I hate asking for help. I'm one of the worst, but...
You know, if you'd broken your leg and I said, here's a crutch, you'd have said, fine. If your mind's not working as it should do, it's a little bit of help to get you through a difficult period. You come out and you then get on and with your life again. And that's all it is. It's no different to that.
Very true. Hey, that is brilliant.
Okay, nice to meet you. Take care and see you again.
Okay.
Bye-bye.
Thank you. Cheers.
Come through, come and
Thank you.
How are you, Margaret?
Nice to meet you. Thank you for seeing me.
No trouble. How are you?
Well, not brilliant, but okay. I've come in because my nurse asked me to come in and see you. I've written it down because I won't remember otherwise. The not so good news under the circumstances is that in 10 days I've lost about 6 pounds, which is too much. I couldn't eat, and when I did eat, zoop. I really couldn't face it.
So you're having diarrhea?
Yes.
How long has the diarrhea been going on for?
10, 12 days. And I mean, I've never not been able to walk, you know, and that I literally didn't. I could stagger, but I just didn't. I mean, it's ridiculous.
May I have a feel of your tummy?
Yeah. This is, funny enough, the tummy is behaving itself, you know. I haven't had lack of pain for a long time.
OK, so I'm just going to gently press.
Having said I haven't got any pain when you touch her, I have.
Is it sore when I'm pushing now? Or?
There. Yeah, there. Yeah.
Just now listen to the tummy. Good. Jump back down for me. Margaret was diagnosed with a form of kidney cancer in 2009, and in 2015 it was discovered that she had a recurrence. She was currently enlisted in a trial under the specialists, and she is undergoing treatment for this. Now, there's a few things that we are going to do, Margaret. Because you've had 14 days of diarrhea, it absolutely could be a side effect of your medication. However, I just want to make sure that there's no other cause or other reason why you'd be having the diarrhea.
Right.
So I'm going to ask you to send off 2 stool samples for me. When was the last time you had any blood tests?
Every 6 weeks.
Because you're getting the ongoing diarrhoea, I'm going to request my own.
I think this is just a little glitch, and then we'll be off and running again.
Absolutely. So here is what we are going to do. Okay, so that's your blood test form. So you book that in at your convenience. You can get that done here. These are the stool samples. Have you ever given a stool sample before, Margaret? Okay.
Thank you.
No worries.
I'm calm under fire.
It is important to make sure that we prioritise the most important ones. And, you know, the weight loss, ongoing diarrhoea is definitely something that we need to get sorted. I want you to chase your oncology appointment to get a review with them, and I'm going to give you something to help you with the weight, OK? And come back in and see us, Margaret. If this isn't settling down, I definitely want you to come
Don't
back
worry,
and
I'll
see us.
be here. Thank you. I think you've had the 10 minutes now, more actually.
Don't worry. The 10 minutes is only a guide. It's more important than making sure that we manage you as a patient effectively. Every individual is an individual. So add this to your blood test as well and get these things sorted. If it's not settling down, we definitely need to see you. Give us a call a week after you've done the stool samples to find out the
Okay,
results.
don't you worry, I won't mess around. I intend to make 10 years. At least.
Very good.
At least.
Good. I wish all my patients were like you.
Take care.
Love you too.
Thank you.
All right, darling. Bye now, Margaret.
Thank you so much.
No
Bye.
trouble. Bye-bye now. Is that all right?
It's fantastic.
See you later.
Okay, bye, Ashley.
later.
Bye. Be careful driving.
Thank you very much.
Okay.
Thank you so much.
Oh, he is so sweet. Bye.
Squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
You know, just thoughts about ending it all and how I'd do it.
I know it's a nuisance when you're there, but it's just delayed things for you anyway, hasn't it?
Thing is, I'm absolutely furious. Away. That was even bigger.
Seriously?
Have a look.
Oh my goodness! Oh my god!
Good morning, Anisha speaking. How can I help? Hi, Jackie. Hi, come on in. How are you?
I'm good, thanks. And you?
Good, fine. I've got Dr. Dillon with me, who's just started with us. So she's just watching at the moment. Right. How are things?
Fine, but it's really daft. But I got a bee sting. On Saturday, and it didn't hurt really at the time. But yesterday and today, it's swollen up and it's so sore. So I just went to the pharmacy just to see what can I put on. I've been putting Antisan on it.
Okay.
And I've taken Piriton, but it's just so sore and itchy. But he said, oh, I think it might be infected because it's a bit hot and throbbing. So he said, oh, just see.
So this happened on Saturday?
Saturday.
Yeah. Okay. And I'm just going to squeeze your nails, so it's just going to be a bit sore for you. I'm not actually convinced that it's infected.
Oh, good.
It's really difficult with fingers because if you'd kind of got bitten here, it would just swell and
Yeah.
be able to swell a lot. Whereas with fingers, for some reason, they can only just swell a tiny bit.
Right.
And if they get to a point and they just get too tight and it gets really sore and throbbing, which is what
Yeah,
you're
this is
feeling.
what it's like, yeah, but I'm sure that's fine then, do you think?
It is fine. So antihistamines are the right thing to do.
Okay.
The other thing that would be really good is if you can elevate it. So tie your arm up so it's around your shoulder. That would
Right.
just help gravity to kind of get rid of some of the swelling, and hopefully it would get better. But I don't think it's infected. They're a pain, aren't they?
I know. I mean, I have been stung before, but I can't really remember it. But honestly, even at night, I've been waking up because I've been going on it, and it's so hot and
yeah.
sore. Right, that it?
That's all.
Don't need to do anything. Lovely.
No, fine.
Okay.
Keep doing
thank
what you're
you.
doing. Yeah.
Lovely. Thanks a lot.
Bye.
Bye.
Oh, and then guess what? When I went home yesterday, I'm like, what's that moving? Them proper ones with a big, long leg spider, thin one, yeah. Literally, it was right where I had walked into. So I was like, oh my God, I just touched that. Nastiness.
Nastiness.
Hello, come through. Please have a seat. I'm so sorry to have kept you waiting so long. I apologise for that. How are you?
I'm all right.
Great.
I don't know if you remember, I had a spine fusion
Fracture.
operation, yes, to sort of fuse the fracture. I don't know whether this is related at all, but since that operation, I've had these weird, they're very difficult to describe, these weird pains all down through my legs.
Frances had originally come to the surgery a number of months after she'd fallen over in the snow. She had significant back pain, and an X-ray actually showed a broken bone in her back. She went on to have an operation to stop the pieces of bone from moving around, as it was thought that that was what was causing her back pain.
The minute I lay down to go to sleep, turn on my side, and then it's like electric shocks just whizzing up and down my legs, all around my knees, hips, ankles. It's really distracting, and sometimes I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
Had you ever had it before the operation?
No.
When did this start?
Well, it's hard to describe because it's kind of crept up. I'm just sitting like waiting for you then. You know, I had sitting like that and I get pains down here and it's weird. But going to bed, I sort of lie there and it's like, okay, it's starting. I can feel it starting. And then they whizzing around, bizarre electric shock type pains.
Electric shocks?
It's sort of what it feels like. They kind of creep up on you and then they go they whiz.
Do you have pain in your back now?
No, the bone pain went immediately as soon as they fused the bones. The muscles have taken ages to heal.
So these pains, is it mostly in your right leg or your left leg or both?
Mostly my right leg.
I might ask you to pop your trousers off if that's okay. Jump on the couch and then there's some more blue roll that you can just pop on your lap if that's okay.
Yeah.
And if you give me a shout when you're ready and I'll come through. Great, so I'm just going to check all the nerves in your legs if that's okay. What I'd like you to do now is push up off the bed with that leg and now that side and pull down and the other side and bend your knees up for me and push me away with that leg. Push me away, pull me towards you. I'm just going to lift your leg up and rest it on my arm. I want you to go completely relaxed and floppy. Good. Feel free to pop your things on, come and have a seat. Right.
It's weird, isn't it?
It is. I'm not completely sure what the problem is. What I'd like to do is do some blood tests to check some of your vitamins and sugar control and stuff like that, and then see you with the results, and we'll make a plan about what to do. Does that sound okay?
Yeah. But you don't think it's from what they've done on my back? That's what I was more concerned with, that it was...
No, I don't.
You know,
Because the nerves which supply your legs come out much lower down.
yeah, okay.
Okay.
Right, thanks.
No problem.
Thanks very much.
See you again.
You're making tunes for us.
My neck hurts. What are we up to?
Apart from being very, very angry, now I went to St George's. I got there 2 o'clock. She looked in both ears, clogged up with wax.
Right.
So she said, you have to see the doctor in order to get syringed.
Right.
3:25, I was rather miffed because I was still sitting there.
So I guess what's happened is you left without your hearing test.
I
And you
left
came the other day to get your ears syringed and there was a problem there. And so your ears are still filled with wax and I'm going to need to refer you again to get them sorted out. Is that right? Is that where we're going with the story?
More or less,
Yeah,
yes.
okay,
But
fine.
the thing is, I'm absolutely furious. I've been a bit worried about my hearing in the last couple of years or so.
Yeah.
I don't catch things that people say and everybody else does.
Partner keeps telling me to get my ears checked because she thinks I'm going deaf. She also talks to me when she's not in the same room and expects me to hear her.
The one on the left, it sounds like roadworks at night.
Oh, really?
As I'm talking now, I feel as if I'm hearing out of this ear, this ear, but not this ear. Very well.
There's a little bit of gunk coming out of his right ear.
Let's have a look at the ears now. So what were you coming to tell me today just about this story? Was there anything new?
Well, actually, I was coming here, hopefully with clean ears, in order to make another referral. Because I came to the conclusion, that referral you done the last time.
So I've done several referrals for this. I really understand with Ian why he was so frustrated at being kept waiting at his hospital appointment. The problem is that all the clinics and services are really overused and oversubscribed. And so inevitably there are delays in treatment. Sometimes I think people forget that. People will get the care that they need, but often it may not be as smooth as they'd hope.
But at the same time, I'm not impressed by these olive oil drips because every time I put the cotton wool in and take it out just before going to bed, it's just the staining of the oil.
So the reason we get you to use the drops is hopefully it will encourage it to come out, but if not, it softens it, so it will make it a lot less painful for you to have that wax removed. So I know it's a bit of a nuisance having it done, but similarly, it needs to be done for us to get the wax out.
Yeah, I understand that. What I was thinking, though, is like going back to an old and tested method which worked, was getting the olive oil, not the drops, heat it, and then pour it in, and then put in the cotton wool, because the heat from the olive oil going in is going to melt it a lot quicker than cold olive oil.
But it will also damage the skin in the ear. So I wouldn't heat up oil and put it in your ear. I think that would be a disaster.
I'm not saying it's going to be boiling. It's
you'd warm it, but
just warm it.
Yeah, I probably wouldn't do that, Ian. If it were my ears, I definitely wouldn't. Had you just sat there a bit longer at the clinic, you probably would have wax-free ears now. I know it's a nuisance when you're there, but it's just delayed things for you anyway.
I've got other things to do rather than sit around waiting.
I do get that, Ian, but at the same time, you're going to not have your hearing so well for the next couple of months while we get this sorted.
Nothing unusual then, is it?
Okay, right, all done.
Is it? Yeah. Right. I will sort that out.
Okay.
Bye.
Bye.
There's nothing especially wrong, but there is something that's concerning me, and I don't know whether it's something or whether it's nothing or what. But just to give you a bit of background, my best friend was diagnosed with ovarian cancer 2 months ago.
Okay.
And I don't know whether it's just because it's very close to home and I'm seeing her and speaking to her every day, that it's making me concerned about ovarian cancer, other types of cancer, just all sorts, really. I appreciate that this is probably so stupid, but when I push in my ribs here, I feel like I'm pushing something back. Whether it feels like, I don't know if it feels like a gland or I don't think it's a lump, and I feel like it's always been there. Like it could have been there 10 years ago, but it never would have worried me. Never thought anything of it. But now, because my mind is just like in overdrive, it's kind of was nothing, and now it's something, and I almost just need to come and speak to someone, and just so I can.
Sounds like you did need to.
Yeah.
So let's feel your tummy and see what there is. So, hands are cold. So actually, show me where you felt at the top.
Here.
Yeah.
So if I'm lying down now, I actually can't feel anything. But you know, I just find myself there all day going.
Feeling it.
And now, and then I think, because I think that's, I feel like I can feel something constantly, and I know the minute I'm not thinking about it.
Okay, let's start with this and see. Okay, tell me if you get any pain at all. Okay, so when I did that, not painful anywhere?
No.
Okay, let's get you to stand up. Okay, and then show me where, feel it if you can.
If you put your hand there,
Yeah.
I feel like I can feel something.
Okay, yeah, I can feel that.
And then just a
you
little
think
bit,
it's the
and
same
then-
on this side or something on this side. So the same place?
Yeah.
Okay. That feels like muscle, actually.
That's it.
That actually is one of the big muscle groups in your abdomen
Right.
that we're feeling.
Okay.
As you felt elsewhere, you've got obviously the main big muscle groups, which are in the middle.
Yeah.
And there you can clearly feel those in
Yeah.
you. But I think that's what we're feeling in this case.
Right.
In terms of organs,
Yeah.
you have the liver here, and
Yeah.
I can feel that.
Yeah.
The spleen's kind of at the back, right at the back here.
Yeah.
Then you've got your kind of kidneys there. You
Yeah.
can't feel those there, further at the back.
Yeah.
Your womb would be about here.
Okay.
Bladder and womb kind of all level, and your ovaries will be somewhere like here.
Mhm.
So it's miles away from
Yeah.
where we're feeling.
Yeah.
In terms of what you felt, I'm definitely not at all worried.
Right. Okay.
Okay.
That's yeah. You know, as I said,
Yes,
my
no,
friend didn't have anything like
fully
that at all, and
understandable.
she's the same age as me, and it's completely come out of the blue, and it just makes you question everything, I think.
Yes.
But yeah,
How did she find out then? What happened?
So she said in the morning she'd lie down, she'd press her.
Oh, and she felt something.
And she felt a lump, and so she was just like, I really should just go and check this out and just put her mind at rest. And then fast forward 2 months, she's had a full hysterectomy, cervix, ovaries, everything out. Luckily, she's already had her kids, but now she's just recovering from that operation. She kept saying, as long as, if anything comes out of this, if you're worried about anything, you just go and get it checked out. And which is why I came, really, just to sort of, I'm sure I'm probably being stupid, but...
No, but as you
We just need
said,
someone to
it's
tell
worth checking out. It's
Yeah.
worth checking. And something you don't know what it is, it's worth checking.
Yeah.
So in this case, it's fine.
Great.
But if you do find anything else, do come back.
Wonderful. Okay.
All right?
Thanks very much.
All right, bye-bye.
Bye.
See you.
It's like musical rooms out here, boy.
They've all just shuffled around, so they're in different rooms, but we're aware of where they are and stuff, so it's fine.
Come in. Hello. You all right? Oh, no, the room. I get moved around a lot.
Yes.
It's very unpredictable. So, in terms of your blood results, we've been trying to decide whether or not you needed to go and see somebody about this tummy pain.
Yeah.
Over a number of appointments, Leslie and I had discussed his abdominal pain, his diet and his lifestyle.
I buy some, what they call, not chicken nuggets. I eat, like, say, 30 of them in one go.
The last set of blood results was completely normal. And I think, actually, you probably don't need to go and see somebody about your tummy pain unless it's bothering you.
Unless the blood tests come back a bit.
No, the blood tests are normal. Because we've talked about your diet quite a bit and the fact that it can be very erratic. I think that you can get some tummy pain if you're not eating a regular and healthy diet.
That's right, yeah. And that's why I go to these nutrition classes. So I've been to a couple and, you learn a lot. Initially, you walk out the building thinking, oh, yeah, next time I get money, I'll go and buy some of this, some of that, some of this, some of that. Because when I get the money, it goes on what I normally buy. I think to myself, well, I should really buy a whole bunch of salad.
Yeah.
And you know, just eat like a rabbit for a week or a couple of days. You know, that's what you call it, rabbit food.
Rabbit food. I didn't know you were going to nutrition classes.
Yeah, we had one in the house. And,
what kind of house is it that you live in?
It's like a hostel. I was offered a place 2 years ago and I didn't take it.
Okay.
Because of their rules.
Yes.
Their rules being you can't have a beer.
No.
And it's not so much that, you can't have a beer outside. So I'll give that the elbow. But this place here, they don't say you can drink, but if you do drink in the house, just drink in your room.
Leslie and I have talked about his alcohol consumption. I'd really like to work with Leslie to try and help him to eat a healthy diet and to try and reduce his alcohol consumption. So let's conclude. Your tummy pain, you've had it for 20 years.
Well, yeah.
It's not too bad. We know your diet's very erratic, and you've told me nothing like a swallowing problem or bleeding or weight loss, which makes me worried.
Yeah, okay.
Okay?
Yeah.
Lovely. Good to see you again.
Yeah.
So come and let me know if this tummy pain is worsening, and then we can do a referral.
Yeah, okay.
All right?
Yeah. I'll see you in there.
Yeah.
Okay.
Bye.
Where's the sandwich list?
Egg and cress.
No, I don't want egg and cress.
I don't know, something like chicken, like, I don't know, New York.
Tuna and spring onion.
Tuna.
And spring onion. You only do tuna and spring onion, isn't it?
Never had that one before, but spring onion is quite nice.
Hi, Mark.
Hey.
I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah. Well, I had my first CBT appointment for 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
So I'm just going to try and go to bed at 11 every night and cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about 2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary. And, like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head and that sort of thing.
Yeah.
Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I'd do it. But, I suppose they're quite occasional still. They're not like regular, but they're still quite sort of, it can last for an hour or two, sort of thing. I'm quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, it's not that regular. It's probably every other day, every few days, maybe something like that.
And what do you think about what you would do, or what your options are?
Yeah, that sometimes. Yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
Okay.
Yeah.
You know what I'm like.
Yeah.
I will panic.
You're worried if you don't know.
And I'm worried and I panic and then I get depressed because I don't know what's going on.
Like if I'm asleep, I quite often wake myself up thinking that I'm kind of choking a little bit.
You're not actually, when you wake up, you're okay.
It's fine, but it's kind of like a panicky kind
Yeah,
of thing.
I was going to say, it sounds a bit like a panic attack.
I think you put a bit of weight on since I last saw you, haven't you? Yeah, you used to be a skinny chap.
I did. Well, it's all to do with my inactivity and
Oh dear.
depression.
Oh dear, I'm sorry to hear that.
I've had a lot of stress over the last couple of weeks because it's the end of our financial year and we've all been scrabbling to try and do our numbers.
Yeah.
I think you're unwell at the moment, and I do genuinely think that you will get better.
Yeah, yeah.
You know, I do have that hope.
Yeah.
You know,
Yeah.
that you are ill, and you know, I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well, you know.
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive. Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
You know, in terms of safety, in terms of those suicidal thoughts, like if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we wouldn't want you to do anything when you're not, you know, well.
Yes, sure.
You know, that has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Let's do 4 weeks, because you'll have seen the psychiatrist by then, and
yes,
it'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right.
Thanks so much.
See ya.
Bye.
Nothing for today, I'm afraid. Oh, actually, I've got a 4:30. That'll be with Dr. Pierce. Yeah. What's the date of birth?
What was the appointment for today?
It's itching. I'm getting these marks around this area. It's mainly upper body and around neck as well.
Okay, let's have a look at the rash a little bit more.
You want to take off?
Yeah, if we lift this up, see where the main bit of rash is. Okay, it's quite noticeable, isn't it? Do they come up as little pustules or?
No, it's the same, but it's very irritating, you know.
Yeah. Okay, and do you share a bed with anybody at home?
No.
Okay. How long have you had the rash for?
This is, I think, about 4 or 5 days. This front side.
And it's very itchy.
Yeah, but the back one, you know, because I can't see it. So
the back's where it started off, though.
But I think it's not much now, probably.
Yeah, it's not a very specific one, but has been itchy on there.
Yeah, but it's a long time. But the last few days, it's just mainly here, and then yesterday I had a very bad towards the neck. It was like here.
Just very itchy around there. And what do you do work-wise?
I'm an accountant.
I'm an accountant, so not exposed to anything
No.
doing accountancy.
No.
I wonder, just looking at the rash, whether or not it could be a type of rash called scabies, which is caused by a little mite that lives on the skin. It's the sort of thing that you can pick up, sort of sleeping in a hotel bed or anything like that, where somebody else.
It's the same bed I'm sleeping, and it's not being shared with anyone.
Scabies is the name that's given to a condition where the skin is infested with a small mite that lives just under the skin surface. Some of the myths associated with scabies may be that it's a disease that dirty people have, but in actual fact it's something that we can pick up at any time. This will be something that they would have come into contact with a number of weeks before, maybe really anything up to 6 to 8 weeks before the itching has started.
And yesterday I requested the antifungal cream for because I feel smell down the bottom between legs and armpit.
Let's have a look at the armpits as well. Let's have because we might just try a tablet from a fungal point of view. Okay, and in there, so it's very itchy around here. Yeah, it could be. It's not very classical of intertrigo. And a similar thing in the top of the groin.
Yeah, here. It's not itchy.
Yeah.
But it's a smell.
The antifungal cream tends to improve that, does it?
Yeah. Because it's after a long time I'm having it, because it's worked really good.
Well, let's try a slightly different approach to it, and we'll go down the route of a medication, like a tablet form of the cream. The areas where this is happening whether or not there is a fungal component to it. It's difficult to know. But we'll see what happens with this rash over the next 2 weeks. OK.
Thank you very much.
Take care. Take care.
What we can do for you is we can either book the next appointment, which will be next week, or if you don't feel able to wait till then, I can get an on-call doctor to call you today. Are you available to take a call today?
Come in.
Right. Well, it is, it started Monday. I've got an abscess or a boil in my mouth. Can you see where it's swollen?
I can, yeah.
Right, do you want me to open it up?
Well, when did it start?
Sunday night, yeah, I didn't think it was. I think it's there on my gum. Can you see it?
Yeah. Let me just wash my hands.
Well, I just washed mine before I came out, but yours are probably cleaner. But I can't figure out why it's affecting my cheek.
So, what did you notice, first of all?
Monday I woke up and I went, oh, something with that. Because I wear a little plate, and it's near where the plate is, but I don't think that's doing it.
When did you notice the swelling of the
this
cheek?
morning. I didn't even, I got up and had a quick wash and that. I'm going to need a bath tonight. But I washed like that, I was in a hurry, I went like that, took those bits off as you do. Once a week, shave tonight.
Yeah.
And I got somebody went, what's up with your face? I went, what do you mean? I said, well, there's a big swelling in the right hand side.
Let's have a look then, so. Can you put your tongue on the top of your mouth like
I can do that.
Not just at the front of your mouth, so like that. Okay, fine. And then just relax. Okay?
Okay.
And does this, I'm just going to press on you. Does that hurt?
Not in the cheek.
Yeah.
Where is it? You can press the bit that you think it is.
Tell you what, just, can you lift that up? That's
How's
great.
that?
Oh, it's a nasty infection, isn't it?
Oh, well, I don't know how I got it. Brush my teeth and all that.
Can you do me a favour? Can you get both of your hands
And with both
lift
wrists,
it?
right? Hold
Yeah.
on, hold on. But how's that?
Yeah. That's great. Okay, fine. When did you last go to the dentist?
So that was 2 months ago. I'd never have any trouble with the
so you
dentist.
went 2 months ago.
Yeah, they put it in. I'm due for another checkup.
Did you smoke?
No, I stopped. I'm stopping. I've seen Mr. Passois at the moment since last September.
How many years did you smoke for?
A lot of years. Since about 16 or 17
16,
years.
so 45-ish years.
But I've been chewing a lot of gum, but that wouldn't do it, would it?
No. What about alcohol?
I've cut back down on that and all.
Have you ever drank in excess?
Maybe years ago. That stopped in the last couple of years, pal.
Okay.
Sorry.
Okay, that's
Yeah.
fine. That's okay.
Aye, maybe I've done something that
It
touched
could,
it and I
I
shouldn't
think the
have
most
done.
likely thing is an infection. I
Could
agree,
have
it's a
been
bit
me taking the
unusual.
gloves off, and sometimes you go like that if you're sweating on site. You know.
So what, I'm going to give you some antibiotics to treat the infection. Probably be a good idea to try and see your dentist as well.
Right.
Okay. I'm going to give you some mouthwash
Right.
as well
Okay.
to use just to keep it all clean. So you're going to take some ibuprofen 3 times a day with food.
Yeah.
So that's for pain and swelling. If you're still in pain, you can take paracetamol on top of that.
It's going to be high as a kite.
In a couple of weeks, if there's any problem at all
Make
with
an
your
appointment.
gum, you need to come back. Because in people who've been heavy smokers, especially if you've been drinking drinkers as well, we always need to make sure that everything heals up properly. Because if
Right.
it's not, sometimes it can be a sign of something nasty like mouth cancer. Okay? All right.
Thanks very much for your
All
help,
right.
Doctor.
Pleasure.
Shan? I'm saying it wrong, isn't it?
Shan.
Shan.
Yeah.
Shan. Right, Shan.
All right.
Thank you very much.
Bye.
Aaron speaking, how can I help?
Have you brought a urine sample in today?
No, I didn't.
One of the tests is a stool sample. Okay. So you'll need to drop that off for us if you don't mind.
Are you able to provide one quickly now?
It's touch and go, I can try.
I've brought a sample because I hope I'm pregnant.
Okay. Good.
Don't know if you need that.
I don't actually,
Okay.
but I would know it's good to bring it. We don't tend to repeat them here, but I'll ask some
Okay.
questions. The tests that we do here are exactly the same as the ones you buy over the counter. So, when was your last period? Is the first question.
29th of
What do you
June.
mean? June. Okay. And your periods are normally quite regular, are they?
Well, they are, apart from, I don't know if you've seen, but I've had 2 miscarriages and one was recent, so I actually haven't had a period since the
then.
last one.
So that period you're saying on the 29th of June was...
Yeah, the
A
miscarriage.
miscarriage, okay. Yeah, I'm sorry to hear. I saw that. I didn't realise you'd had one before as well. When was the previous miscarriage you had?
It was
In April. Okay. And were both of them early in the pregnancy, or?
The first one was about 8 or 9 weeks.
Okay.
And then the last one was like 6.5, 7 weeks. So.
Okay. So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Miscarriage is quite common in early pregnancy, particularly in the first trimester, which is the first 12 weeks of pregnancy. Clearly, it's always very upsetting whenever a miscarriage does happen, and it's understandable at her reaction at being very worried about this new subsequent pregnancy. However, having one miscarriage does not significantly increase the risk of having a future miscarriage.
Any little twinge, I'm like, ugh.
And what happened last time? Did you have some bleeding or pain, or how did it come to light?
So the first one, yeah, pain and cramps. Well, the first one started with sort of a little bit of brown discharge, and you know, you convince yourself that that's okay because it could just be old blood, etc. And then but I did sort of have period pains, and the second one was earlier, and it was the same sort of thing.
What a hard year you've had. That's
I
know. No, not good. Okay.
I saw it this morning.
I know you did.
Well, what with my foot and how I feel, I don't feel good at all. That's why I left the message this morning, that I thought I had some more steroids, but I haven't. So that's what I need, I think. It's been a job to breathe. Breathe through my mouth, not through my nose. It's been blocked up.
Your nose has?
Well, I keep blowing it, you know. But
Okay. And how long have you been having difficulty breathing for now?
A couple of days.
A couple of days?
Yeah.
Okay. You seem more breathless than normal.
Yeah, I am.
Yeah.
I can't do anything without sitting down.
Okay.
All right if I sit for hours, I can't do that.
Can I just check your temperature? And check this side.
I don't think I've got
No. Have you been managing to look after yourself?
Yes.
Yeah? Can I pop your finger in there?
And my foot is killing me.
Have you got an appointment yet?
I've had it. I phoned them up.
Yeah.
They gave me a boot. Well, that's a joke.
Ah.
I tried wearing it, and what that does, it takes you off the floor that much.
Right.
So your hips ache because you're walking out all out of line. No good. It is very difficult, very soul destroying.
I think the hard thing is I don't think there are any other options really.
Well,
apart
that's what
from
he told me.
painkillers and
Yeah.
time. Your oxygen levels are quite low today. They
And
haven't been this low for a while. One option is to go into hospital.
What can they do?
I can't breathe, I can't cope. I wake up 3 times a night and my partner is waking up. It's just getting worse and worse. I can't just breathe because it's constantly being blocked.
I sort of feel wheezy and, you know, sort of that I always need to sort of cough.
Just feels almost like I'm sort of gasping for breath. It feels like I'm just kind of restricted.
Lips tight on the cardboard bit, and then fire the air out fast.
Okay.
So it's a real...
I like your dress.
Thank you. It's new.
Nice, nice and bright, nice.
If you sit forwards for me. And just breathe in and out for me.
I had the blood test this morning.
Okay. So obviously your breathing's not so good today. It's quite a lot worse than normal.
Yes, I know, from what I can do.
And your oxygen levels are quite a lot lower than normal as well. One option is to go into hospital. The other option, which is potentially more risky, is to try and look after you, you know, here and at home.
Well, if I could have another go here at home.
Okay. The benefits of staying at home compared to going into hospital is that there's less waiting around. It tends to be a less stressful environment for their recovery. Also, they tend to sleep better as it's less noisy. And also, there's a reduced risk of infection. If we felt it was safe for somebody to stay at home, we would always try and keep them at home. But obviously, we need to take their wishes into consideration as well.
If you tell me exactly what I've got to do,
Yeah, okay.
then I'll do it.
Yeah. I'll ask the respiratory nurses to come and visit you tomorrow.
Yes.
Okay? But if you have any problems, call the surgery as well.
Okay.
Yeah? Because we can
What
help.
such as problems?
Look, if your breathing's getting worse or you
Yeah.
can't manage at home.
Yeah, well, I would tell you.
Yeah? Okay.
Thanks a lot.
All right.
Yeah.
Pleasure.
Thanks very much.
I'm seeing you next week, aren't
It
I?
was raining when I came.
Looks
I
like it's stopped now.
I think it's all right. Thanks, Doctor.
All right. Bye.
Thank you.
By the way.
What may be worth doing, given your history, is getting you an early scan in the pregnancy.
Yeah,
so
that'd be
we can
good.
check everything's going okay.
Yeah, that was one of the things I wanted to talk about, and then just if there's anything that I can do. Obviously, I'm willing to just try. I've stopped running, which probably I don't know if it's a good thing or a bad thing. I'm really trying to do everything I can, so at least then I can say to myself, with nothing I've done.
Yeah, and I think that's normal to do that, and I think that's probably an appropriate thing to do. There isn't any evidence that running in any way will affect or doing sport will affect it, but human nature being what it is, it's not. If that's the decision made, that's fine to do that. Yeah. To be honest, whether it makes it better or worse, it's mostly out of your control because it's more to do with the DNA of the embryo that's forming rather than anything that you were doing. I think it's really, really hard when you've had such a difficult year. I think the best thing we could probably do is figure out your dates now and try and get you a scan about 7 weeks so we can see, and there's an early pregnancy unit at St George's.
So what will they be able to see at this early stage?
And hopefully at 7 weeks you should be able to see a heartbeat, you should be able to see the gestational sac in the womb, and if they can't, what they would do is then bring you back the following week so they could scan you again.
Okay.
All right.
Cool.
Okay.
All right.
Do you want me to dispose of this?
Yeah.
I don't really want to carry around.
Lovely.
Okay, well, I hope it all goes well next week.
Yes,
okay.
I'll let you know.
Good.
Thanks very
All
much.
right. Bye.
I'm not too sure. Bear with me a moment. Is ear syringing messy?
Messy? They get messy, yeah.
No, they won't get messy.
No, it won't get messy, no. All right then, okay. Bye.
So have you had your ears syringed before? No. Irrigated or anything, no? It's not a painful procedure, it's just feels a bit weird, warm water in your ear.
Okay. Yeah.
Just come and take a seat over here. Thanks. So if it does start to hurt, because it's not supposed to, then let me know and I'll stop. I'll put this here, don't get wet. Hold this cup under your ear like that for me. Look straight ahead. Keep your head just like that. Like that, straight ahead.
Yeah, cool.
You ready?
Yeah. Oh, wow. Feels alright, actually. Whoa.
There it is. Quite little lumps come out.
Oh my day.
What?
Oh my day. That sounds bizarre.
How does it feel?
I can hear you. You sound like you're shouting.
Have a look in the cup if you want. Does it feel good then?
It feels amazing.
There you go. Let me have a look in quick.
Oh my god.
That's the best reaction I've had.
I'm gonna listen to some music tonight.
Yeah, enjoy. All right, let me just move you around here just a little bit. That's it, and then out. All right. And just look straight.
Yeah.
I'm gonna begin, yeah?
Yeah.
There we go. Wow. Wowee. That was even bigger.
Seriously?
Have a look.
Oh my goodness. Oh my god.
What? The hearing?
Oh my goodness.
It's weird, isn't it? Let me have a look.
That is amazing.
Let me just look.
You don't value
Your hearing.
until it gets taken away from you, like from the guns or something.
You see the big lumps in there?
I see.
Mm.
It feels weird. I can hear myself inside.
Right, there you go. 2 crystal clear ears. Oh, sorry.
Oh my goodness. I'm meant to feel like this. I can hear myself inside.
Because you're not used to having normal hearing. They've been blocked up God knows how long.
Yeah.
So this is how sound should usually be.
Okay. Oh my goodness.
There you go. Happy?
Yeah. I'm more than happy.
Good. There you go. All right. Take care. If ever you need it done again, you know what to do. Take care.
All right, nice to see you, Barbara. Bye.
Nice to see you. Take care. Bye-bye.
All right.
Love to see you.
That's okay. Thank you.
Okay, I love you. Thanks for seeing me.
No problem.
Yeah, thanks a lot.
Take care.